It was actually, I'd come into the emergency room, and he was actually, I guess, the podiatrist on call or whatever, and we just hit it off right off the bat. I mean, just down to earth person, and just he made it, just explained everything, and just made me feel at ease as far as what was going to happen and what we were doing and stuff like that. So
right.
I enjoyed meeting him from the first day. I've been a diabetic basically my entire life. I found out when I was 13, and had no diabetes education as a kid, and then by the time I was in my 20s, I was 10 feet tall and bulletproof, and when I decided to start taking care of myself, I was already down that road, and and it's a very ugly disease for people that don't realize what it is. I mean, it'll kill you just like cancer or anything else will, and I've unfortunately, because of the blood flow and things in my feet, I've had to have some amputations of some toes, and Dr. Nagler's done, unfortunately he's had to do more than one, so he's just he's always taken good care of me, and and talked about what we can do to try and correct it from here out, and other than what I can do to take care of myself, how to take care of my feet, and things that he can do, preventive type stuff. So we've been working on that for the last couple of years, also. I come quite often, just because of the pressure points and stuff on my feet. I develop calluses and stuff like that, so I come pretty regularly, to try and get the calluses taken care of. That way, hopefully they don't lead to the ulcers and all that stuff. But unfortunately, I guess in the past 3 years, I think we've taken off 3 toes. So it's just been, but we're slowly working on trying to figure out how to do it and how to get it fixed. And he's been very proactive with trying to say, let's try this, let's do this, let's see this person have some orthotics built for shoes and stuff like that. So this last procedure I had done was done December the 22nd, which was the Friday before Christmas, and he took time out of his weekend on Saturday, because they did it as an outpatient. So I wasn't, fortunately I wasn't in the hospital over Christmas holiday, and he took time out of his day on a Saturday just to call and say, how you doing? You need anything? What does it look like? And unfortunately my wife and I have kind of become pretty familiar with what to look for, and he kind of trusts me to call him and say, hey, this doesn't look right, or let's get in and get it let's get in and get it taken care of. So I mean, yeah, just truly cares, and hey, we need to do this. Like I say, he just we become real proactive with it, and and just there's been times that hey, a foot will swell or something, and hey, I don't think something's right, doc, but I'm starting to run a little bit of a fever, I've got a little bit of inflammation, and he just says, okay, well, here's what we're going to do. We'll take care of it, whether it's a Saturday, a Sunday, a Monday night, at 7 o'clock at night, just get in here tomorrow. Let's not wait, and let this thing progress. Yeah, he truly does care. And that's one thing I can say about him. Fortunately, I've had a lot of doctors, but I've found a few now that I go to. They're that they help me get straightened out, and he's one of the main ones that takes care of me. Pat, love her to death. She will definitely tell you right, just straight up the way it's been. Michelle, Kathy, I mean, they're all just it's pretty sad in a way that you can call the doctor's office and they know you by the sound of your voice, but that's just to me, that's just the personal service that they give. You're not just a patient. You're not just somebody off the street. They really, there's been times that Pat's worked me in because I need something, and she knows, and I think that's a reflection of just being with Dr. Nagler in the way that he is. They truly, I think they all care about you as a person, and Michelle, she's always said, okay, here's your paperwork for this and that, and go do this and go do that. And it's just, Kathy always asks about, I consider them friends, we always ask how your kids, my kids are, and they know my daughters. If my daughters are with me, they speak and talk to them, and they know what's going on in their lives. And so it's really a personal type relationship, I feel, more than just, a doctor, a staff, patient kind of situation.